Okay. So I'm going to record this for everyone also, and then I'll see if I can put it in our newsletter for this week. So any questions you have, just again, put in the chat. And what I wanted to talk about this week is, I didn't want to put this on a live Facebook feed because I have too many veterinary friends, but for the PetWise membership, I think it's really important that we talk about going to the doctor with your pet and what that might look like. I have a lot of clients who obviously see me because they want to be a little bit more inclusive in their pet's care. So they want to, use whatever they can in the best way they can, whatever's available to make their pet feel better and to get their pet the best health. So that might include traditional medicine, with the drugs that are available and getting a diagnosis. That might involve some more herbal or natural remedies, or just dealing with the diet. That might include things like chiropractor, acupuncture, acupressure. And it might just include serenity medicine, some energy healing medicine. And I have to say, I have a lot of clients who seek out advice from intuitives. And, in the past, I have to say, I wasn't skeptical of it. I believe there is something to it. I don't have that skill. But I would always, tell those people, I think this is what's going on with your pet. We can see it from their, how they're communicating to you and how they're acting and what they're eating or not eating and how their personalities have changed. And you get a vibe. And your pets are telling you things if you pay attention to it. And then I would find that if people sought out an intuitive's advice, it was adding another level of information that they needed to make proper decisions with their pet. So it might have been something that they weren't quite thinking about, like maybe their pet has a headache or a toothache, or just something that you wouldn't really notice. Toothache you might see, but a headache, what would that look like in a pet? Are they head rubbing? Are they yelling at night? Certain things like that we just don't use as a symptom in pets because we can't ask them if they have a headache, and there's no way to test for a headache. So those types of things are dismissed in the regular veterinary world, where if you seek out an intuitive, you start thinking, wow, I never would have thought of that. No one's mentioned that to me before with this condition. And then you start thinking about other things that might help your pet. So I find, any and all of these tools are really, really helpful. What's not helpful is when someone, I'm going to say like a doctor, tells you to do something and we just do it. People see a white coat. There are studies that when people are told something by someone in a white coat, they actually listen to it and they do it without questioning. And in these same studies, the same people will say something to someone without a white coat on, and the person doesn't do it or believe it. So, we see someone in a white coat, and these are people that have spent a lot of time and money in educating themselves. They're probably pretty smart people to get into that level of education in the first place, but they're limited. And I see a lot of doctors who are very smart and very caring, but it comes to a point where they tell their clients, I can't help you anymore. We're doing the most that we can do. And that's not always true. There are other alternatives that you can seek out. And I think in our world today, we're very lucky to have things like the internet, or to have things like alternative medicine, so that we can make a proper decision and have all of these things useful. In the past, there used to be all of these things that were out there for us to use with our pet. Things like herbal medicine was actually the medicine that people depended on before medical school started in the 50s. And quite honestly, a lot of what drives these industries are money. And not necessarily the doctors, but the money is going to places where it doesn't need to. So on that note, communicating with your veterinarian can be a little bit of a challenging thing. I see a lot of people with good intentions thinking they go into the doctor and let's say they don't want to get a vaccination for their pet and they'd rather do a titer. And they're talked out of it very quickly. And not only that, they might go in and their pet actually is not feeling well. They have a GI problem. So here you go with a pet and you're going for for a vaccination with a pet who's not up to their best immune system. You know, their immunity is not up. They have a GI issue going on. So at that point, the doctor should not give a vaccine. They should really, you know, try to figure out why your pet has a GI issue. And instead what happens is they give the vaccination, and that's taxing the immune system. They send you home with something called Flagyl or metronidazole, and that's a drug that is in some countries, it's actually banned in some countries. It's a antibiotic, and it helps with the GI. It really helps with diarrhea, but you're sent home with this medication and maybe some Pepsid or a shot of Cerenia, which can help with vomiting and settles the stomach, but also, you know, it's another drug. And then they're given sub-Q fluids. So, you know, there's all of a sudden this bill for $400 or $500, and really your dog's stomach is just off, or your cat's stomach is just off. And instead of trying to figure out why is your pet's digestion off, you're just given all of these drugs to suppress all the symptoms so that it looks like they feel better, but they really don't. And then on top of it, you're given a vaccine to stress the immune system at a time when it shouldn't be given a vaccine. So why don't we say no to these things? I can tell you that I have been scared by doctors about my pet's health. I had a dog in heart failure, and it was when I was just learning about herbal medicine. You know, it was a time that I really wanted to try to do some more natural treatments with my pets, but I come from a system, and I work with people in a system of hardcore medicine. And I was actually told by a doctor, I said I wanted to try dandelion with my dog to help maybe decrease the amount of diuretic medicine that I was giving. I was actually told that if I decided to do that, I would kill my dog. And it just made me stop and think, like, how can dandelion, a weed, kill my dog? It doesn't make any sense. And at that point, I just decided, like, that is just not the right advice. You know, it could have been something that was supplemental. They could have said instead, I'm not very well versed in that. I'm not quite sure. So I don't recommend it, which would have been a fine answer. I don't think everyone can know everything about everything. But I do think that we need to take more of a stand with our pets, and we don't have to fight or argue with our doctors. I think they're needed. But doctors are very, oh, here we have a little visitor. Come here. Come, come. But doctors are very good at their job. And what their job and training is to diagnose. So it's doing diagnosis, and they do that by doing tests. So they're very good at taking tests and interpreting test results. And then at that point, once they come up with a diagnosis, then they're very good at prescribing medicine. So, you know, they know what medicines work with other medicines and what a medicine will do. And also doctors are good at doing surgery for things that need surgery and that can only be repaired by surgery. And from that point on, you know, it's hit or miss. I think today I see a lot of newer veterinarians that are coming through, and they are a little bit more inclusive. They're a little bit more open to alternatives. They're a little bit more open to different options and want to learn about them. And they want to hear from their patients what they're doing. I think they'd like to learn those other things. And I think in vet schools now, they are teaching a lot more of these things, and they're a little bit more open to it. So there's a lot more evidence out there for these things. If your doctor's not on board with it, and, you know, if they just tell you that they're not educated on a certain herb or a certain practice that, you know, a certain modality that you want to practice, then that's fine. I think they're being open with you. There's no problem. But when a doctor tells you something extreme about it and just says you'll kill your pet if you do this, or, you know, that's stupid. I've had clients actually have their vet tell them that they're stupid for thinking that. That's not a good relationship, and you might want to ask around and find someone else to go to. You want to have a good relationship with your vet, and there's certainly a place for veterinary medicine, especially in emergency situations, in critical situations, with, like I said, with surgery, some forms of dental care. You know, that can be really a hard place in medicine to handle with pets, so that's really useful. But otherwise, you really want a doctor that's going to cooperate with you. Okay, let's see. No questions yet. Let's see. I had a question from someone. Um, we had a question about CBD, and I wanted to talk a little bit about pain. And I was doing a little bit of research, and at one point there was this doctor who was trying to really promote pain as the fifth vital sign. So, as our vital signs are defined as signs like respiration, heart rate, pulse rate, blood pressure, those are signs within the body that tell you that how the body is functioning. And if those signs are absent, it means that there's no life. So it's a vital sign. You have to have some kind of heart rate or respiration rate or something going to show that your body is alive. And by trying to promote pain as the fifth vital sign, that was a really hard sell because pain is not a vital sign. So to be in pain or to have discomfort, it's not something that, with or without it, it's not going to determine how alive you are or what your status is. Now, chronic pain is debilitating, and it's a discomfort, and it does cause other cascades to happen in the body, which cause poor health. So if you have an animal that's in chronic pain, it's constant inflammation in the body, and that can lead to things like poor digestion. Or if you have constant pain in a certain area of the body, like a joint, if you have some kind of arthritis, that can lead to depression. Actually, chronic pain can lead to depression. It also leads to a poor quality of life because your pet just can't do the things that they used to, and they're just in this constant state of not feeling well. So making pain as a fifth vital sign, I thought was a really, really interesting topic. And there's a lot of pain today, and you wonder where does it all come from? Is it our lifestyle? Is it the food that we're feeding our pets? Is it poor breeding? Where is all of this pain coming from? And it's hard to say. It comes from a lot of different places, and it's something that usually builds up over time. It could be something like possibly your pet isn't getting the right vitamin or mineral, and maybe some joints are breaking down, or maybe in their, nutritionally, that's kind of the basis of good health is nutrition, and having a good lifestyle. If they're missing something, then maybe adding that back in over time will help with the condition. But talking about pain, and a lot of the medications out there, they may be necessary at a certain point, and they may, I wouldn't deny someone a medication for pain, certainly. But right now we had a question about CBD, and there is so much CBD information out there, so many companies that are promoting their products and different types of products. So you have CBD treats for pets, you have CBD oils, you have liposomal CBD. You have oils, you have pills, you have oil in pills, you have coconut oil, CBD. So what do you do? What do you pick? And right now I'd say it's hard. There is one that I like that I've been consistently recommending. Oh, and I get nothing from this, but only because I know it's a company that I've researched, but you could always, try it. And if you think it works, what I would do first, if you're going to try a CBD for your pet, is to try it for yourself first and see what your reaction is. And then just try a small amount on your pet. And you can always build up from there. I'd say for a cat, starting at something like 3 milligrams might be good. A large dog, you could start at 5 milligrams, 7 milligrams, and go up from there. It depends on what the situation is. I'd say CBD is a really good thing to try if your pet has a GI issue. It can really be soothing for GI issues. It can be really good for anxiety issues. And for pain and arthritis, it can be helpful. It may not be the best thing. You might have to use it in conjunction with some other herbals and some maybe other like heat packs. If you go in the PetWise membership, we just had a video on pet massage for arthritis. I mentioned heat packs in there, and I think there's another video, warming your pet in the winter, that goes through different heating devices and getting your pet getting the arthritis that way. But for CBD, if your pet has a condition like cancer, CBD can be helpful, certainly, but also it may not be enough. And I have several clients now using cannabis, which is a little different than the hemp-based CBD. The cannabis actually has the THC in it. And you see warnings all over the place about giving THC to your pets, and I agree. I've seen pets who have gotten into their owners' marijuana. It is not a fun thing to watch. Their heart rate is all over the place. They feel nauseous. They're kind of looking around like all dazed. Sometimes they have to be hospitalized if it's really bad. But if your pet has a chronic condition and medication is not working for them, it can be a helpful thing. It can be given rectally, and it can be given orally also, rectally. I have a client who's using it for her cat that has facial cancer. So it has a tumor on its face that is blocking part of the nostril. It's inhibiting the cat from eating. I would assume that it is also there's some kind of headache going on. I'm sure there's pressure in the head and the cat has a headache. And it's really hard to give the cat medications by mouth because she does not want to be touched in her mouth. So the owner decided, and she's having trouble getting help from a veterinarian because they feel like she should just euthanize the cat. And that's the only option they're giving. So she's having trouble finding resources to help her. And she decided to try cannabis. And the cat has been doing well. She's been sleeping. She's not yowling in the middle of the night anymore. She's actually tolerating feedings, and she's eating, so she's keeping her weight up. And her quality of life is improved. Realizing that this probably won't go on forever, but it's something that's improving her quality of life, and that's all we're asking for. So it's a consideration, something that you can think about if you wanted to try something like that with your pet. What else? Do you have any questions? No questions yet. So I'm going to. So I'll talk about the PetWise membership for a minute. We have. I'm going to be changing over some of the handouts. So we kind of rebranded all the handouts. They look a little bit nicer when you print them out. So I'll be letting you know when those are getting updated in the membership site. We have another question. Oh yeah, we did have a question about essential oils. So using essential oils on your pet, I keep seeing more and more people, again, it's like the CBD. Essential oils are this huge thing, and mostly because I hope none of you get offended, but the people selling it is it's usually some kind of like pyramid scheme kind of thing for the selling of these essential oils. And the only time I would recommend an essential oil is as a tick or a bug repellent. It's really good at that. So you want to use it a little sparingly. I think the handout is done maybe on the essential oils handout and how to make your own tick or bug repellent. So I'll try to post that this week with the newsletter. And we do have a question. Hi, Barb. CBD brand that I recommend. I've been using and testing one called Pet Relief. It is, let's see if I can type it in the chat box. So it's Pet, PetReleaf.com. So Pet Relief, leaf is in leaves. I find like it's a pretty consistent company. They've been very responsive to phone calls. Their website actually is very informative, and they give all the right information on the website. And I actually didn't fully answer the question before that someone had about CBD. And it was, a question about the liposomal CBD, because that one it's much more expensive to give that. The benefit to liposomal CBD is that it bypasses the gut. So the pill is treated in a way that it bypasses the gut, and then it can actually get into your pet's system much easier. But I would recommend starting, if you're going to try it, you can just start with the oil. And all you do is, the Pet Relief actually makes their oil in a coconut base, so it actually tastes good. My dogs will lick it from my fingers. So I kind of use them as test subjects. And after I tried it, and then I use them as test subjects, and it actually had a very calming effect on them. I wouldn't say they don't have any real medical problems now, but it definitely made them calmer. You know, I'm out for the day usually. I'm out doing home visits, so I'm not home a lot during the day, and they would get a little anxious when I was leaving. And if I gave this to them 10 or 15 minutes before I left, they would just be lying on the couch and looking at me like, okay, I'll see you later, where before they'd be a little bit anxious. And then when I get home, they kind of didn't jump up to greet me. They just kind of slowly, they were just relaxed. So I did see a difference with that. I think Pet Relief, if I remember correctly, comes in maybe like a 350 milligram strength and maybe a 500 and maybe something like 750, something like that. Or maybe 715 and 1300, whatever it is. But I'd say if you have a 20-pound pet or less, then I would try the 3.5 milligram. If you have a pet that's over maybe 20 to 50 pounds, 60 pounds, you might want to try the next strength up. And what you can do is, if you buy a lower strength one, you can just try maybe like a few drops on the gums first, just to try it out and see. If that's not having the effect you want, you can try a few more drops, and just keep going up in the dosage. And if you get the lower dosage one, you might have to just give more of that product. So that's why I would recommend, if you have a bigger dog, to maybe get the medium dosage amount. And if you need more information on that, just email me. I think you all have my email, and I can let you know more about that. But usually I think for GI issues, anxiety issues, and maybe for mild arthritis pain, or in conjunction with another anti-inflammatory, it can be a pretty useful thing. Let's see. Okay, so we talked about the herbal oils. And the other thing for seizures, yeah, CBD could be really helpful for seizures too. Trying to think of what else for seizures. It could be helpful, I would say, because it would relax. It would relax the nervous system. So it would depend on where the seizures were coming from, probably, but it would not be contraindicated. So I think if I had a pet that seizured, I would definitely recommend it. Let's see. I have another recommendation for seizures that I am going to look up now because it's not coming to me. You know, if your pet has chronic seizures too, I'd really recommend like a good detox, maybe changing diet. I would not ever give them a vaccine again. I would talk to your vet about maybe exempting them from vaccines for life, and from any chemicals. I would really, you know, cut back on those things too. Someone's outside. Let's see. Seizures. Oh yeah, okay. So for oh yeah, skull cap. Okay. So CBD really with the from cannabis might be more helpful for seizures. There's actually in human studies, they do have a cannabis that's manufactured by the pharmaceutical company. It's one of the first pharmaceutical cannabis is recommended, and it's recommended for seizures. So there's different strains of cannabis too, so you'd have to research it. But yeah, you'd want probably the stronger cannabis, not the CBD. But I would start with CBD. It might be all that your pet needs. You never know. Skull cap and maybe valerian would possibly be good things for seizures if your pet has chronic seizures. And again, it's going to depend on why your pet is having seizures. You know, do they have a blood glucose issue? If that's the case, then these things are not going to help that. If it's something that's been undiagnosed, then the skull cap and valerian may be good. Those are also calming things in skull cap if you think of the head. So if it's something that's kind of like being triggered in the brain, if your pet has a tumor somewhere that's causing seizures, I would say there are probably some other drugs that might be better, because what you want to try to do is shrink that tumor. So it really is going to depend on where that seizure is coming from. But yeah, I would definitely try it. Why not? The CBD is not going to hurt at all. It's not contraindicated at all. It actually works along with the body, so it could be a really helpful thing. Okay, so I think we're going to wrap it up. If you have any other questions, send them in, and we'll try to keep doing these little chats once or twice a month. I'll keep letting you know when we're going to have them. And if you want to send in your questions ahead of time, I'll keep recording these and sending them out to you. And I hope that is helpful. And I'll see you next time. Okay, have a good day. Bye-bye.